Hello, everyone. I'm Lance Gonzalez.
I am Sofia Joyce A. Hermoso.
I am Christine M. Lazaga.
And I am Lisandro Ian M. Labad, and we are the reporters for Concepts of Mental Health and Mental Illness Crisis.
Mental health and mental illness will be further discussed by Ian and Lance respectively.
Mental health and mental illness are difficult to define precisely. The culture of any society strongly influences the values and beliefs which can affect how a society defines health and illness on the mental aspect. World Health Organization defines health as a state of physical, mental, and social wellness, not merely the absence of illness or infirmity. Townsend identifies mental health as a successful adaptation to stressors from the internal and external environment, evidenced by thoughts, feelings, and behaviors that are age-appropriate and congruent with local and cultural norms. However, there is no single universal definition of mental health that exists. Generally, a person's behavior can provide clues to his or her mental health. In most cases, mental health is a state of emotional, psychological, and social wellness evidenced by satisfying interpersonal relationships, effective behavior and coping, positive self-concept, and emotional stability. But it is dynamic or an ever-changing state. Here are the factors influencing a person's mental health. Individual or personal. A person's biologic makeup, autonomy and independence, self-esteem, capacity for growth, vitality, ability to find meaning in life, emotional resilience or handiness, sense of belonging, reality orientation, and coping or stress management abilities. Interpersonal or relationship, effective communication, ability to help others, intimacy, and a balance of separateness and connectedness. And social, cultural, or environmental, a sense of community, access to adequate resources, intolerance of violence, support of diversity among people, mastery of environment, and a positive yet realistic view of one's world.
According to American Psychiatric Association, mental disorder or mental illness is a clinically significant behavioral or psychological syndrome or pattern that occurs in an individual. It is associated with present distress, risk of suffering death, pain, disability, or important loss of freedom.
Now go to the historical perspectives of the treatment of mental illness. Ancient times. People of ancient times believed that any sickness indicated displeasure of the gods and, in fact, was a punishment for sins and wrongdoing. Those with mental disorders were viewed as being either divine or demonic, depending on their behavior. Individuals seen as divine were worshipped and adored. Those seen as demonic were ostracized, punished, and sometimes burned at the stake.
Aristotle 382 to 322 BC. He attempted to relate mental disorders to physical disorders. He developed his theory: the amounts of blood, water, and yellow and back bile in the body controlled the emotions. These three substances corresponded with happiness, calmness, anger, and sadness. Imbalances of the four humors causes mental disorders. Treatment includes restoring balance through bloodletting, starving, and purging. Such treatments persisted well into the 19th century.
In the early Christian times of 1 to 1000 AD, primitive beliefs and superstitions were strong. All diseases were blamed on demons. Mentally ill were viewed as possessed. Priests performed exorcism to rid evil spirits. When that failed, more severe and brutal measures, like incarceration in dungeons, flogging, and starving, are opted.
In England, during the Renaissance period, people with mental illness were distinguished from persons with criminal liabilities. They are called dangerous lunatics, thrown to prison, chained, and starved. In 1547, the Hospital of St. Mary of Bethlehem was officially declared as a hospital for the insane, one of its kind. By 1775, visitors are charged for viewing the inmates and ridiculing them who were seen as animals, less than human.
Period of Enlightenment and creation of mental institutions. It began in 1970s. Philip Pinel in France and William Turks in England formulated the concept of asylum as a safe refuge or haven offering protection that initiated the moral treatment of the mentally ill. Dorothea Dix, 1802 to 1887, U.S., began a crusade to reform the treatment of mental illness. She opened 32 state hospitals that offered asylum to the suffering. She advocated adequate shelter, nutritious food, and warm clothing. Period of Enlightenment was short-lived. After a century of the establishment of the first asylum, the state hospitals were in trouble. Attendants were accused of abusing the residents. Insane asylum took on a negative connotation.
Sigmund Freud and the treatment of mental disorders. The period of scientific study and treatment of mental disorders began with Sigmund Freud and others such as Emil Kraepelin and Eugene Bleuler. With these men, the study of psychiatry and the diagnosis and treatment of mental illness started in earnest. Freud challenged society to view human beings objectively. He studied the mind, its disorders, and their treatment as no one had done before. Kraepelin began classifying mental disorders according to their symptoms. Meanwhile, Bleuler coined the term schizophrenia.
Mental illness had no pharmaceutical treatment since time immemorial. Not until the 1950s, where the first ever psychotropic drugs was developed. Chlorpromazine, the first ever antipsychotic drug, and lithium, an anti-manic agent, were the treatment for mental disorder begun. The following 10 years after its development, many medication treating mental illness emerged, such as haloperidol and benzodiazepines. These medications help people to shorten hospital stays and reduce agitation, psychotic thinking, and depression.
Mental illness in the 21st century. National Institute of Mental Health estimates greater than 26% of Americans aged 18 years and older have a diagnosable mental disorder. 15 million adults, 4 million children and adolescents suffers mental illness or serious emotional disturbance. Attention deficit hyperactivity disorder affects 3 to 5% of school-aged children. About 1/3 of homeless people suffers from serious mental illness and more than 1/2 have substance abuse. Health services provided in the community must be individualized, available, and culturally relevant. For that, Access was created and funded by the federal government to improve access to comprehensive services across a continuum of care, reduce duplication and costs of service, and improve the efficiency of services.
Community-based care. The 2,000 community mental health centers that were supposed to be built by 1980 had not materialized. By 1990, only 1,300 programs provided various types of psychosocial rehabilitation services. The Treatment Advocacy Center 2008 reports that about 1/2 of all persons with severe mental illness have received no treatment of any kind in the previous 12 months. Persons with minor or mild cases are more likely to receive treatment, whereas those with severe and persistent mental illness are least likely to be treated. Community support service programs were developed to meet the needs of persons with mental illness. outside the walls of an institution. These programs focus on rehabilitation, vocational needs, education, and socialization, as well as on management of symptoms and medication.
In the 1990s, a new form of managed care called utilization review firms or managed care organizations was developed to control the expenditure of insurance funds by requiring providers to seek approval before the delivery of care. Psychiatric care is costly because of the long-term nature of the disorders. Moreover, mental health care is separated from physical health care in terms of insurance coverage. Mental health care is managed through privately owned behavioral health care firms that often provide the services and manage their costs. Two of the greatest challenges for the future are to provide effective treatment to all who need it and to find the resources and to pay for this care. The Healthcare Finance Administration administers two insurance programs, which are Medicare and Medicaid. Medicare covers people 65 years and older, people with permanent kidney failure, and people with certain disabilities. Meanwhile, Medicaid is jointly funded by the federal and state governments and covers low-income individuals and families. Unfortunately, not all people who are disabled apply for disability benefits, and not all people who apply are approved. Thus, many people with severe and persistent mental illness have no benefits at all.
Cultural considerations. The U.S. Census Bureau 2000 estimates that 62% of the population has European origins.
Thus, nurses must be prepared to care for this culturally diverse population, which includes being aware of cultural differences that influence mental health and the treatment of mental illness.
Psychiatric nursing practice. In 1873, Linda Richards graduated from the New England Hospital for Women and Children in Boston. There, she became the first American psychiatric nurse, and she believed that the mentally sick should be at least as well cared for as the physically sick. This started the first training of nurses to work with persons with mental illness, and it was in 1882 in McLean Hospital in Belmont, Massachusetts. The care was primarily focused on nutrition, hygiene, and activity, but the role of psychiatric nurses expanded as somatic therapies for the treatment of mental disorders were developed. The first psychiatric nursing textbook was Nursing Mental Diseases by Harriet Bailey and was published in 1920. In 1913, Johns Hopkins was the first school of nursing to include a course in psychiatric nursing in its curriculum. It was in 1950 that the National League of Nursing required schools to include an experience in psychiatric nursing.
Two early nursing theorists shaped psychiatric nursing practice. These are Hildegard Peplow's interpersonal techniques, the crux of psychiatric nursing, and June Mellow's nursing therapy. Peplow's theory focuses on client-patient therapeutic relationship, while June Mellow's nursing therapy described her approach of focusing on clients' psychosocial needs and strengths. Both of these theories substantially contribute to the practice of psychiatric nursing.
Self-awareness issues. Self-awareness is the process by which the nurse gains recognition of his or her own feelings, beliefs, and attitudes. In nursing, being aware of one's feelings, thoughts, and values is a primary focus. It is important to remember that nurses' values and beliefs will conflict with those of the clients or with the client's behavior. The nurse must learn and accept these differences among people and view each client as a worthwhile person regardless of that client's opinion and lifestyle. The nurse does not need to condone the client's behavior. He or she merely needs to accept them as different from his own or her own and not let them interfere with care. The nurse also needs to discover himself or herself and what he or she believes before trying to help with others with different views.
Points to consider when working on self-awareness. Keep a diary or journal that focuses on experience and related feelings. work on identifying feelings and circumstances from which they arose. Review the diary or journal periodically to look for patterns or changes. Talk with someone you trust about your experiences and feelings. This might be a family member, friend, co-worker, or nursing instructor. Discuss how he or she might feel in a similar situation, or ask how he or she deals with uncomfortable situations or feelings. Engage in formal clinical supervision. Even experienced clinicians have a supervisor with whom they discuss personal feelings and challenging client situations to gain insight and new approaches. Seek alternative point of view. Put yourself in the client's situation and think about his or her feelings, thoughts, and actions. Do not be critical of yourself or having certain values or beliefs. Accept those or work to change those values and beliefs you wish to be different.
Crisis. When someone hears the word crisis, the first thought that would come to mind would be problems. But what really does this word mean? According to Cambridge Dictionary, crisis is an extremely difficult or dangerous point in a situation. Kaplan had spot 4 stages of crisis. The first stage is when an individual experiences stressors and tries to cope up. Second is when coping is not effective, hence increased anxiety. Third, the person pushes more efforts to alleviate the stress. And lastly, when efforts are all ineffective, thus bringing abundant distress. Crisis.
Yes, that's right, Lance. There are 3 categories of life events and situations where an individual experiences crisis. 1 is the maturational crisis or developmental crisis, which encompasses the normal life cycle such as marriage, having a baby, or starting a new family. Next is the situational crisis, which refer to events which are unprecedented, which includes a death of a loved one, job loss, and physical or emotional illness of the individual or its family. Last is the adventitious crisis, also called social crisis, which includes natural disasters, war, terrorist attacks, and violent crimes such as rape and murder.
Not all events that can cause crisis are overall negative. For example, marriage and childbirth. These can be stressful, but it also presents desirable feelings. According to Aguilera, there are 3 factors that influence whether or not an individual experiences crisis: the event perception, emotional support, and its coping mechanism. A crisis is self-limiting. It usually lasts for about 4 to 6 weeks. At the end of the time, the person may return to his pre-crisis level of functioning or begins to function at a higher level. But some people tend to function at a lower level of functioning than pre-crisis time, which is a negative impact on an individual. There are many crisis interventions which are based on the individual's assessment. These are the directive interventions and supportive interventions that aims on dealing with the person's needs for empathic understanding and promote problem solving, such as offering the person's new information, knowledge, or meaning.
And that's it for the concepts of mental health, mental illness, and crisis. Thank you so much for listening. This has been Sophia and my colleagues, Lance, Christine, and Ian. Have a great day!